I'm audible? Okay. So this is the mixed bag anatomy MCQ session, 4th part, concurring for the NEET PG examination. Myself, Dr. Monalisa, MD Anatomy from Forces Medical College Pune, has got a total of 9 years of teaching experience, and we are discussing with the sessions which we are covering the MCQs. This is mixed bag anatomy MCQ series. Yes, so everything is fine and we can go with the session now. So let's talk about the special class. What are the features of special class? It's a highly interactive session where the learners and the educators can interact. Polls are conducted. Raise your hands, get your doubts clear, light itself when the session is going on. Never ever miss a session. Once the session is finished, you can also download the PDF notes and you can study anytime, anywhere from the top educators of Unacademy platform. So use this code NAT10 to get an extra discount of 20% if you are going to take the subscription till today. Okay, plus subscription, all 19 subjects completed in a very systematic way. You can study from top educators of Unacademy platform. You can compete in live tests and quizzes. You can study on the device of your choice, and you can have an access to 25,000 and more MCQs. You can use this code and you can get a discount of 20% if you are going to take the subscription till today. So you can have an access to 25,000 and more MCQs made by the top educators of Unacademy platform. Iconic subscription merging of the Prep Ladder and Unacademy has been done. Well structured course, recorded full syllabus course, 25,000 MCQs, along with it merging of the video lectures, clinical integrated session, rapid revision, snapshots and treasure dream notes of 2021. All these can be assessed by you. So you can again use a code and get an extra discount of 20%. Congratulations to the toppers of FMGE December session 2021. All the best to the upcoming session, my dear aspirants. Okay. Other than that, I would also like to tell you about the doubt clearing session which is taken by the top educators of Unacademy platform and plus platform. So again that these sessions are taken by the top educators of Unacademy platform, and this is the new addition which is done for the done on the platform of Unacademy, and you can use my code NAT10. This will be highly beneficial for you. By using this code, you can get an extra discount of 20% if you are going to take the subscription. Other than that, Unacademy Lite for the NEET PG aspirants is already on, and you can be the part of this session and launching the previous year question papers which can be which is dedicated for the past 3 years previous year question papers of INICT, FMGE examination and that of NEET PG. So past 3 year papers which will be highly beneficial. NEET PG free test calendar, these are all the benefits which can be assessed by you. Use this code and get an extra discount of 20%. Other than that, launching the first year prof course which will be highly beneficial. Why? Because you can get in-depth comprehensive concepts coverage, clinical integrated essentials, PDF notes, recorded version. Go for it. NEET PG high yield theory batch is on and high yield revision MCQ batch is on, and also NEET PG end of the year sale is on. If you are going to take the subscription, here you can definitely get the 20% discount. Okay, so you can use my code NAT10. Now let's start with the MCQ session. Now let's start with the first MCQ of today's session. Which is correctly paired here? Which of the following structure is correctly paired here? Flexor pollicis longus, anterior introosseous nerve, flexor digitorum profundus, anterior introosseous nerve, extensor carpi radialis longus, posterior introosseous nerve, Brachioradialis, posterior introosseous nerve, abductor pollicis longus, anterior introosseous nerve. So my dear aspirants, please have the correct answer. So which of the following is correctly labeled? Means match the following. Which is the correct match the following for this muscle and their nerve supply? So your time starts now. Please mark the right answer. Which of the following is the correct match the following? So yes, let me just check which is the correctly paired with its nerve. Okay, anyone wants to give the answer? Otherwise, I will come up with the answer. The correct answer is flexor pollicis longus having anterior introosseous as the nerve supply. So yes, my dear aspirants, here the correct answer is flexor pollicis longus. So yes, my dear aspirants, flexor pollicis longus, the nerve supply is by anterior introosseous nerve, and that is absolutely correct. Flexor digitorum profundus, when we are talking about flexor digitorum profundus, its nerve supplies anterior introosseous nerve is wrong. It is getting branch from not only anterior introosseous nerve, branch of deep branch of median nerve, but it also gets innervation from ulnar nerve. Extensor carpi radialis longus is not getting innervation from posterior introosseous nerve, it is getting innervation from radial nerve. Brachioradialis is also not getting innervation from posterior introosseous nerve, it is getting innervation from radial nerve. Abductor pollicis longus is also not getting innervation from anterior introosseous nerve. Abductor pollicis longus is the muscle of posterior compartment, so it is getting innervation from the deep branch, that is spin. It is getting innervation from the deep branch, that is posterior introosseous nerve, that is the deep branch of radial nerve. So, absolutely the correct answer is option A. Now, getting to the question number 2, great cerebral vein of Galen is formed by, what is the veins which is leading to the formation of great cerebral vein of Galen? Great cerebral vein of Galen is formed by which of the following combination of veins? Whether it is two internal cerebral veins, superficial middle cerebral vein, deep cerebral vein, anterior cerebral vein, internal cerebral vein, and that of the straight sinus. Which is the right answer, dear? So, among the 4 options, according to you, which is the best answer? Great cerebral vein of Galen is formed by. Great cerebral vein of Galen is formed by. Okay. So, according to you, which is the best answer? Great cerebral. The correct answer is great cerebral vein of Galen is formed by 2 internal cerebral vein. So, I would like to show you the image for it. Great cerebral vein of Galen is formed by joining of 2 internal cerebral vein. So, let me just enlarge this image. So, yes, when I am enlarging this image, you can very nicely see that this is the internal cerebral vein, and this is the internal cerebral vein of one side, and this is the internal cerebral vein of the other side, joining and draining into great cerebral vein of Galen. So, this is how the great cerebral vein of Galen is formed. So, yes, absolutely A is the right answer. 2 internal cerebral vein leads to the formation of great cerebral vein of Galen. Let us mark the third MCQ, question number 3. Okay. Root value of common peroneal nerve. What is the root value of common peroneal nerve? Dorsal branch of ventral rami L4, L5, S1, S2, S3, ventral branch of ventral rami L4, L5, S1, S2, S3. So, 4 combination of the root values have been given, and you have to mark the right answer, root value of common peroneal nerve. What is the root value of common peroneal nerve? What is the right answer, dear? Root value of common peroneal nerve. According to you, which is the right answer? Root value of common peroneal nerve. Please mark the right answer, root value of common peroneal nerve. Okay. So, actually if we talk about the common peroneal nerve, it is the smaller terminal branch of, so Dr. Sri has given his answer C with a question mark. Dr. Sri Rathod, C is absolutely right. Yes, it is the dorsal branch of ventral rami of L4, L5, S1 and S2. Absolutely correct there. This is absolutely correct. So, let me show you. So, if you will see, sciatic nerve is having 2 terminal branches. So, one is, so see here, dorsal division. If we are talking about dorsal division, so when we are talking about dorsal division, the dorsal division of L4, L5, S1, L4, L5, S1, S2, which is a smaller terminal branch, dorsal division of ventral rami of L4, L5, S1, S2 is forming the common peroneal nerve. And when we are talking about the ventral division, when we are talking about the ventral division, so yes, ventral division of the ventral rami of L4, L5, S1 and S2 is forming the larger component of the sciatic nerve, that is tibial nerve. that is the tibial nerve. Okay. So, yes. Now, let us move on to the next question number 4th. Suboccipital triangle is composed of, which of the following is the correct answer for suboccipital triangle? Suprolateral supromedial border is forming superior oblique and rectus capitis posterior major. So, when we are talking about supromedial and suprolateral border, the muscles forming its suprolateral and medial border has been given. Inferiorly, it is formed by semi-spinalis capitis, floor by C2, roof by trapezius, and greater and lesser occipital nerves are residing. So, my dear aspirant, which is the best correct answer of suboccipital triangle? Which is the best correct answer of suboccipital triangle? Please mark the correct answer. Question number 4th. Question number 4, please mark the right answer there. Suboccipital triangle is composed of which of the following borders? Please mark the right answer. Okay. So, my dear aspirants, A is absolutely correct answer. A is absolutely right answer. So, we have got A as the absolutely right answer here. Suprolateral, when we are talking about suprolateral border of suboccipital triangle, yes, it is formed by superior oblique muscle, but its supromedial border is formed by rectus capitis posterior major. Let me show you this diagram. Yes, Priyanshi, you are absolutely right. So, see here you can see rectus capitis posterior major, and rectus capitis posterior major is forming supromedial border, rectus capitis posterior major is forming supromedial border. And when we are talking about obliquus capitis superior, the obliquus capitis superior is forming suprolateral border. Okay. When we are talking about obliquus capitis inferior, when we are talking about obliquus capitis inferior, it is forming inferior border. And this triangular space is the boundary of suboccipital triangle. Okay. So, borders were exactly correctly mentioned. Other than that, if we talk about its other important aspect which is wrong, inferiorly it is wrong because inferiorly it is formed by the obliquus capitis inferior muscle. Floor is formed by C1, not the C2. Roof is not formed by trapezius, it is semi-spinalis capitis, and greater and lesser occipital nerves are not residing. Here we have got inside suboccipital nerves and that of third part of vertebral artery and suboccipital venous plexus. Contents are suboccipital venous plexus. The contents of suboccipital triangle is suboccipital venous plexus, suboccipital nerve, and third part of vertebral artery. Okay. Now, question number 5th. Which of the following statement about adductor canal is incorrect? It is the communication between femoral triangle and popliteal fossa. It is bordered posteriorly by adductor longus and adductor magnus. It contains nerve to vastus medialis and femoral artery exit through a hiatus in adductor longus. So, which is the right answer? Question number 5, please mark the right answer. So, yes, Priyansi, D is absolutely right. Femoral artery is exiting through a hiatus in adductor longus is absolutely wrong. What is the name of that hiatus? The hiatus is present in adductor magnus muscle. The hiatus is present in adductor magnus muscle, not adductor longus muscle. Other than that, all other options, it is a communication between femoral triangle and popliteal fossa is absolutely right. Yes, Dr. Sri is also right. It is bordered posteriorly by adductor longus is absolutely right, and it contains nerve to vastus medialis is absolutely correct. So, just have a look on this image where you can appreciate the boundaries and the contents of adductor canal. So, very nicely you can see the boundaries. Medially it is bordered by sartorius muscle, posteriorly by the adductor longus and adductor magnus, anterolaterally by vastus medialis. Actually, sartorius muscle is forming the roof, vastus medialis is forming here anterolateral border, and adductor longus along with adductor magnus is forming posteromedial border. My dear aspirants, it is also important to note down the contents which is visible here, because a transverse section of adductor region and also an anterior view of adductor region has been shown, and the structure residing inside is nerve to vastus medialis. The structure residing here is nerve to vastus medialis, femoral artery, femoral vein, and that of saphenous nerve, These all structures are residing inside, and it is forming the content of adductor canal. Also, it is important for you to know that there is nerve plexus below sartorius muscle. So, this has been also asked in the previous year. So, please note down subsartorial nerve plexus. So, in the case of adductor region, please note down subsartorial nerve plexus. So, it is subsartorial nerve plexus. So, it has been asked so many times in the MCQ. So, what are the nerves which is forming subsartorial nerve plexus? 3 nerves are there which is forming subsartorial nerve plexus. One is medial cutaneous nerve of thigh, the other is saphenous nerve, the other is anterior and posterior division of, obturator nerve, the anterior and posterior division of obturator nerve. Got it? So, these are subsartorial nerve plexus. Done with this, now let us move on to the next, that is question number 6th. A 34, yes, Dr. Sri, it is supplying medial aspect of leg and goes towards the great toe, dear. Dr. Sri goes towards the great toe. Question number 6th. A 34-year-old female, Caucasian female, has difficulty in abducting her right arm past the horizontal position. An abnormal prominence of right inferior scapular angle is also observed. So, which of the following is most likely the cause of patient condition? Whether it is a case of thyroidectomy, whether it is a case of anterior dislocation of shoulder joint, whether it is a case of violent stretch between the head and the shoulder, it is a case of clavicular fracture, or it is a case of mastectomy. Question number 6. So, yes, we have got Shravani Churukri, E. Okay. So, yes, absolutely correct, dear. Yes, E is absolutely right answer. So, mastectomy is absolutely right answer, dear. You are absolutely correct. Can you guess the nerve injured? Can you guess abnormal prominence of right inferior scapular region? A scapular angle is observed. So, can you guess the nerve injured? Can you guess the nerve? Can you guess the nerve which is injured here? In case of females having difficulty in abducting her right arm, can you guess the nerve being injured? So yes, the nerve injured is long thoracic nerve. So see here, the patient described in the MCQ is exhibiting the symptoms consistent with the which is consistent with the paralysis of serratus anterior muscle, and the injury is to long thoracic nerve. The injury is due to long thoracic nerve. Paralysis of serratus anterior muscle is having classically two presentations. Absolutely correct, Narendra and Dr. Sri. So first, when the patient is asked to press anteriorly against the scapular wall, the presentation which will be seen is winging of scapula. Other than that, patient with the serratus anterior muscle paralysis is unable to abduct the arm higher than the level of horizontal position. So these are the presentation which is seen in case of injury to long thoracic nerve, and this will lead to a condition of winging of scapula. So this is a case of winging of scapula. Now, long thoracic nerves can be injured in cases of penetrating injury, trauma, and also in the case of removal of axillary lymph node dissection, and that is a case of radical mastectomy. That is a case of radical mastectomy. Okay. Now, question number 7th. Retromammary space is located. Retromammary space. Root value, yes, Dr. Sri, it is formed by the ventral rami of C5, C6 and C7. Yes, Dr. Sri is absolutely right. Yes, Sri, you are absolutely right. Now, retromammary space is located between which of the following structure? Retromammary space is located between which of the following structure? Skin, areola, pectoralis major, minor, breast and deep pectoral fascia, suspensory ligament and that of the skin, lactiferous sinus and the nipple. Which is the right answer? Retromammary space is located between which two spaces or the structures? Yes, please mark the right answer dear. Retromammary space is located between which of the following structures? The correct answer is breast and that of deep pectoral fascia. Yes, C is absolutely right answer. C is absolutely right answer. So, breast and that of deep pectoral fascia, C is absolutely right answer. Breast and deep pectoral fascia is absolutely right answer. So, see this diagram. Here you can see this is the location of retromammary space. Okay, this is exactly the space which you are seeing, this space, this is the retromammary space which you are seeing, and this retromammary space is exactly located between the breast and the pectoral fascia. Retromammary space is exactly located between the breast and that of it is located between the breast and that of pectoralis fascia, pectoralis fascia. This is the pectoralis fascia lying posteriorly. Now, let us move on to the next MCQ. Which is a branch of brachial artery? Which of the following is a branch of brachial artery? Which is the branch of brachial artery? Whether it is anterior posterior circumflex humeral artery, deltoid artery, superior inferior ulnar collateral artery, thoracoacromial artery, anterior and posterior ulnar recurrent arteries. Which of the following is a branch of brachial artery? Which of the following is a branch of brachial artery? Please mark the right answer. So, yes, I got a correct answer from med student. Med student is absolutely right. It's superior and inferior ulnar collateral artery. It is superior and inferior ulnar collateral artery is absolutely correct. Yes, superior and inferior ulnar collateral artery is absolutely correct answer. So, yes, my dear aspirants, let me enlarge it. Can you appreciate this is inferior ulnar collateral artery and this is superior ulnar collateral artery, and these two arteries are arising from this big artery, that is brachial artery. So, both superior and inferior ulnar collateral arteries are directly the branch of brachial artery. Is directly the branch of brachial artery. Now, other than that, let's see the other branches which is given here. So, I would like to show you the branches of axillary artery. So, subclavian artery continues beyond the level of first rib. If you will see the continuation of subclavian artery. So, this is the subclavian artery and beyond the level of this first rib. So, beyond the level of this first rib, it is continuing to become, the subclavian artery continues to become axillary artery, okay, and it gives various branches. It gives superior supreme thoracic, the first branch from the first part is superior or supreme thoracic artery. This is the first branch. Branches from the second part is thoracoacromial lateral thoracic. These two are the branches from the second part, this is the branch from the first part, and 3 branches from the third part. What are they? They are posterior circumflex humeral artery, and anterior circumflex humeral artery, and that of subscapular artery. Subscapular artery. Divided into 3 parts by pectoralis minor muscle. Divided into 3 parts by pectoralis minor muscle. So, clearly here anterior posterior ulnar artery is recurrent arteries, branch of ulnar artery, thoracoacromial artery, branch of axillary artery. Second part, deltoid artery is a branch of profunda brachii artery, and anterior posterior circumflex humeral artery is the branch from third part of axillary artery. So, direct branch is superior inferior ulnar artery, which is direct branch from brachial artery. Question number 9, sorry. Third extensor compartment of wrist contains the tendon of. Third extensor compartment of wrist contains the tendon of which muscle? Third extensor compartment of the wrist contains the tendon of which muscle? Extensor pollicis longus is absolutely correct answer, Yes, ST, you are absolutely right. So, yes, you can make a schematic diagram. So, by this let us make a schematic diagram. This is ulna, this is the radius, and I would like to just shade this. This is the radius, and this is the ulna. Okay. Now here I want to show the extensor retinaculum. So, this is what? This is extensor retinaculum. Okay. Now, this is the first compartment, this would be the second, this will be the third, this will be the fourth, this will be the fifth and sixth. So, this is how many compartments? So, we have got exactly first, second, third, fourth, fifth and sixth. So, it is important for you to know the extensor compartment, 6 extensor compartment muscles lying there. So, we have got 2 muscle tendons in the first compartment, we have got 2 muscle tendons in the second compartment, we have got 1 muscle tendon in the third, and we have got 2 muscles in the fourth, and along with it we have got 1 artery and we have got 1 nerve, 4 structures, and we have got 1 tendons in the fifth and sixth compartment. So, it is important to know the name of individual. So, see here, this is the muscle tendon. I will write the name. Okay, now coming to the naming. So, this is abductor pollicis longus, extensor pollicis brevis, extensor carpi radialis longus and extensor carpi radialis brevis in the second compartment, EPL in the third compartment, extensor pollicis longus, extensor digitorum, extensor indicis. Deep to it we have got anterior interosseous artery and we have got the nerve. What is this nerve? This is PIN nerve. What is this? Posterior interosseous nerve. This is extensor digiti minimi, and the last compartment or medial most compartment is containing extensor carpi ulnaris. So, this is a schematic diagram showing you extensor, showing the extensor compartments, and the structure passing through each extensor compartment, Let us move on to the next, that is question number 10. All of the following muscles are supplied by the structure marked in the image except. So, let me just enlarge it. Can you see arrow marked structure is shown to you, a loop is there. So, identify that loop and then tell me which of the following muscle is not getting innervation from this loop. Your time starts now. Please mark the right answer. All of the following muscles are supplied by the structures in the loop except. The correct answer is thyroid. Yes, in this option the correct answer is thyroid. Okay, thyroid, C is absolutely correct answer. Many of you have given the right answer. See here, Ansa cervicalis loop will give innervation to the superior inferior belly of omohyoid, sternohyoid and sternothyroid, but not the thyroid and genioid. This is directly getting innervation from C1 passing along with the fibers of hypoglossal nerve. Okay, identify. So, question number 11. Identify the histological slide. Please see this histological slide and identify. So, have an enlarged view. See this histological slide. See this histological slide and then mark the right answer. Okay, identify the histological slide. Whether it is bronchus, whether it is epiglottis, whether it is trachea, whether it is bronchiole. Identify the histological slide. 4 options are there: bronchus, epiglottis, trachea and bronchiole. Which is the right answer? Okay, which is the right answer, dear? So, yes, I got an answer, that is trachea. So, C, yes, trachea is absolutely right. Who is this? Yes. So, ST, you are absolutely right. Med student, you are absolutely right. Why it is a trachea? It's a slide of trachea because here you can see this is the part of hyaline cartilage costal variety. So, this is costal cartilage which is shown here. This is the seromucous gland is also shown. The lining epithelium is also pseudo-stratified ciliated columnar epithelium. Actually the correct point for identification is the hyaline cartilage is in the C form loop with is having a perichondrium also covering, and just close to it is a smooth muscle, that is trachealis. So, here we have got a trachealis muscle fibers and hyaline cartilage loop. That is the hint, along with seromucous gland in the lamina propria and pseudo-stratified ciliated columnar epithelium. So, this becomes a slide of trachea. Now, injury to which of the following, injury to the nerve which is shown here in the diagram will cause which of the following presentation? Loss of sensation over hypothenar muscle, loss of sensation over dorsum of little finger, loss of sensation over nail of index finger, loss of sensation over fourth interdigital cleft. So, which is the right answer? Yes, Dr. Shree, trachea is absolutely right. Nail bud, yes, who is this? Nail bud, nail of index finger is the right answer. Yes, nail of index finger is the right answer. See here, this is the nerve. So, which nerve is this? This is median nerve, this is median nerve. Okay, this is brachial artery. This will be the brachial artery. This is the bicipital aponeurosis which you are seeing. Okay, this is biceps tendon, and this elongation which you are seeing is the bicipital aponeurosis. So, this is what, this is bicipital aponeurosis which you are seeing. Okay, this is the bicipital aponeurosis. Okay, and close to it you have got the biceps tendon also. Close to it you have got the biceps tendon also. Next to it, so here you can got biceps tendon, bicipital aponeurosis, and close to it the nerve which is residing here, this nerve. Which nerve is this? This nerve is radial nerve. Okay, so it is clear that the arrow mark structure is median nerve, and median nerve is giving innervation to nail buds. Okay, so median nerve, very clearly you are knowing median nerve is giving innervation to the nail buds laterally. So C is the right answer. So that is the reason C is the right answer. Which tendon is most affected in lateral epicondylitis? Which tendon is most affected in lateral epicondylitis? Extensor carpi radialis brevis, extensor carpi radialis longus, flexor pollicis longus, supinator. Which is the right answer? Which tendon is affected in case of lateral epicondylitis? Which tendon is affected in lateral epicondylitis? Med student, extensor carpi radialis longus. No, my dear, the correct answer is most commonly the tendon affected is extensor carpi radialis brevis. So, we know that lateral epicondylitis is involved, the common extensors origins are involved, but among that the extensor tendon which is commonly involved, most commonly is extensor carpi radialis brevis. ST, you are absolutely right. Extensor carpi radialis brevis is the right answer. So, see here, this is a case of tennis elbow, and in tennis elbow, that is lateral epicondylitis, the most commonly injured tendon is extensor carpi radialis longus. Extensor carpi radialis, extensor carpi radialis brevis, dear. Extensor carpi radialis longus is also involved, but most commonly involved is extensor carpi radialis brevis. So, extensor carpi radialis brevis is the right answer. Yes. So, let us move on to the next. Question number 14. All of the following are true about the structure marked in green as shown in the image. All of the following is true about the structure marked in green and shown in this image. A. Origin from lateral supracondylar ridge of the humerus, lateral intermuscular septum of arm. Insertion proximal to styloid process of radius causes elbow flexion. Posterior interosseous nerve innervates the muscle. Question number 14. Please mark the right answer. All of the following are true statement about the structure highlighted in green color except. Question number 14. All of the following are the true structure about the structure highlighted in green color except. Flexion, brachioradialis is causing flexion, dear. Yes, D is absolutely right answer. Which muscle is this? This is brachioradialis and it causes flexion, and its innervation is directly from radial nerve. Radial nerve. Why D is wrong? Because innervation of radial nerve. Yes, it is by radial nerve. No, med student, radial nerve and musculocutaneous nerve, you are talking about brachialis. This muscle is brachioradialis. Its innervation is directly by radial nerve, not from posterior interosseous nerve. So, D is correct. Okay. So, see here, the details of brachioradialis originates from lateral distal ridge of the humerus, inserts into the lateral distal radius near the styloid process, causes flexion of elbow, supination and pronation of forearm. Flexion of elbow, supination and pronation, and most effective as a flexor of the forearm when the action is in the neutral position. When the action is in the neutral position. Okay. It's okay, it's okay. Confusion is okay, dear. Lateral supracondylar ridge is the origin. Insertion just proximal to radial styloid process. Arterial supply radial recurrent. Nerve supply radial nerve. Action is flexion of elbow, supination and pronation of radio-ulnar joint. Action is flexion of elbow, supination and pronation of radio-ulnar joint. Question number 15. What is the nerve supply of marked structure in the image? So, please identify this marked structure and tell me what is the nerve supply of the marked structure in the image. Yes, posterior interosseous nerve. Which muscle is this? This is supinator muscle. Why supinator muscle? Origin from the supinator crest. It is originating from the supinator crest of the ulnar bone and inserting into the radius bone. Where it is inserting? So, inserting into the radius bone, as you can see, and originating from the supinator crest of ulnar. This is supinator, and we know the nerve supply of supinator muscle is posterior interosseous nerve, deep branch of radial nerve. Question number 16. All of the following structures passes through the question marked fissure in the image except. So, you can see a question mark fissure is shown to you. So, tell me which of the following structure is not passing through this fissure. Yes, supinator crust and the area in front of the supinator crust and then going towards the radius. ST, maxillary nerve, med student, maxillary nerve, absolutely correct. Yes, so this structure is superior orbital fissure, and maxillary nerve is not passing through superior orbital fissure. Maxillary nerve is passing through foramen rotundum. Foramen rotundum, so that is the right answer. Foramen rotundum, so that is the right answer. Other than that, oculomotor nerve, trochlear abduction is passing through superior orbital fissure. So, see this diagram. When I enlarge it, you can see the outline which I am showing you is the superior orbital fissure very nicely, and in the middle of the superior orbital fissure also you can see this tendinous ring is the origin of annulus of Ginn, which is the origin of recti muscle. The structures traversing from the superior orbital fissure is LFT, lacrimal frontal trochlear, superior division of ophthalmic. Through the tendinous ring and middle part, superior inferior division of oculomotor nerve, abducens nasociliary, inferior part say inferior ophthalmic vein, but not the maxillary nerve. Question number 17. Lesion to zygomatic branch of 7th cranial nerve could lead to which of the following presentation? Lesion to zygomatic branch of 7th cranial nerve could lead to which of the following? So, I got an answer from Priyansi and she is absolutely right. Drooping of lower lid. Yes, why drooping of lower lid is the right answer. Zygomatic branch of 7th cranial nerve is giving innervation to the lower parts of orbicularis oculi. Zygomatic branch of 7th cranial nerve is giving innervation to orbicularis oculi. So, yes, clearly E is the right answer. So, see here. This is zygomatic branch of facial nerve, and this zygomatic branch of the facial nerve, as you can see here, it is giving innervation to lower part of orbicularis oculi. So, it is the right answer. It will cause drooping of the lower eyelid. Lacunar ligament is reflection or extensions of the deeper aspect of which of the following ligament? Question number 18. So, I also want to tell, after giving you a break of approximately half an hour, I can tell 9:15 is the another session in which more than 25 questions are been discussed, 25 MCQs. So, that will be a quick revision of 25 mixed bag anatomy MCQs. So, I want everyone to be present live. Okay, just at 9:15, after completing this session, I will give you a break of 20-25 minutes, and 9:15 I will start with the 25 fast track revision of anatomy MCQs. Inguinal ligament is absolutely correct. Who has given this answer? Yes. We know that inguinal ligament is causing its extension from the deeper aspect as lacunar ligament. So, we have got 4 extensions of the link will be provided. It's Let's Crack NEET PG platform. Let's Crack NEET PG YouTube channel. You will get 9:15 Dr. Monalisa Mixed Bag Anatomy MCQs part 5. 9:15 you will just get the link of Dr. Monalisa. So, just see, link will be provided in all Telegram group, my own group also. You will get the Let's Crack NEET PG Telegram group, and also you can search on Let's Crack NEET PG. You can just type Dr. Monalisa Mixed Bag Anatomy MCQs part 5, 9:15. So, a lacunar ligament is an extension from the deeper aspect of inguinal ligament. Actually, inguinal ligament is having 4 extensions. What are they? They are pectineal ligament, they are lacunar ligament, they are reflected part, and they are ilioinguinal ligament. Ilioinguinal ligament. Ilioinguinal ligament. Got it? So, these are 3 extensions of the lacunar ligament. 4 extensions. So, yes, my dear aspirants, inguinal ligament is reinforced in the medial aspect, forming an extension which is attached to the pectineal line or pecten pubis, and that extension is called as the lacunar ligament, extended towards iliopubic eminences, forming pectineal ligament. Centroacinar cells are present in which of the following structure? Centroacinar cells are present in which of the following structure? Parotid gland, no dear, it's a pancreas. Centroacinar cells are present in pancreas. Okay. So, actually centroacinar cells means the serous, yes, it is the correct answer is pancreas, dear, pancreas. So, actually centroacinar cells are actually the intraductal part, duct. We know that duct of the serous acini, which is arising from the outer aspect, but if the duct is arising from the inside of acini, this is called as centroacinar cell, characteristic part of the pancreas. So, see here the duct, in case of pancreas, the duct, initial most part of the duct is arising inside the acini, and this is actually intercalated duct of the serous acini. So, it represents same as the intercalated duct of the serous acini, and this is called as centroacinar cell, which is present in pancreas. So, this is also, you can see the nucleus, you can appreciate the nucleus of centroacinar cell, which is starting from inside the acinus. The duct is starting inside the acinus. Generally, duct starts from outside the acini, but it is starting inside the acinus. So, is it okay, everyone? So, this is the whole detail. So, here parotid gland is the right answer. Pancreas is the right answer, not the parotid, because in parotid the initial duct is called as intercalated duct, but the initial duct in case of pancreas is called as centroacinar cells. Now, my dear aspirants, before ending the session, few more important points which I want you to tell. Those who are interested for taking the plus subscription of Unacademy should definitely go for it. This is the time when you are getting 20% discount. So, use this code and get a maximum benefit of taking the plus subscription. You can use my code ANAT10 and get a maximum discount on both plus and iconic subscription. And many of the offers are starting, and what I want that many of the plus courses are starting also for the first year MBBS course and other courses. So, those who are interested to definitely take the subscription. Today is the last date, 31st March. Yes, my dear aspirants, and all of you, do join at 9:15 session which I will start. Do present for the 9:15 session. That will be highly beneficial for you. So I want everyone to meet in 9:15 session, that is mixed bag anatomy MCQs, which we will complete in the upcoming session in the next 25 minutes, and do present live. This will be highly recommended for you. Okay, all the best, keep studying, and before ending the session, do like, subscribe the channel. Let's crack NEET PG platform. Do like, subscribe the channel, and all the best, keep studying. So let's meet after 25 minutes. Let's meet in the next session. What is the next session? That is the 5th part of the mixed anatomy MCQ session, exactly starting at 9:15 p.m. All the best. See you there, guys. All the best. Thank you. Thanks. So let's meet in the next session. All the best.